When we wear our masks or face coverings, you protect me and I protect you from the spread of COVID-19. But for the best protection against the coronavirus, we must wear and use our masks or cloth face coverings correctly. All persons over age 2 and who can remove their masks themselves should wear one. Before putting on your mask, clean your hands. Your nose and mouth should be covered with no gaps between the mask and your face. Do not touch the mask when wearing it. If you do, clean your hands immediately. Replace your mask when it's damp. Discard disposable masks immediately after use, or wash reusable masks frequently. When removing your mask, do not touch the front. Remove your mask from behind, discard, and immediately wash your hands. Let's protect each other from COVID-19 and wear our masks.
Good evening, Bermuda, and welcome to the members of the media that are here this evening. I'm joined today by the Minister of Health, who will be giving an update to the public on the latest from her ministry, including the most recent test results. Following that, I will give an update on the special statement that I gave to the House of Assembly earlier today, detailing additional restrictions which are set to come into force tomorrow morning. Minister?
Thank you, Burt. Good afternoon, everyone. There were 1,157 test results received by the Ministry of Health yesterday on the 10th of December, and 27 were positive for COVID-19. 13 of the new cases are classified as local transmission with a known contact or source, as they are associated with known cases and clusters. The remaining 14 new cases are classified as under investigation, and these cases are amongst residents who have no history of travel or any currently identified links to any other known cases or clusters. Bermuda now has 391 total confirmed positive cases, and their status is as follows. There are 149 active cases, of which 147 are under public health monitoring, and 2 are hospitalized, with 1 being in critical care. A total of 233 have recovered, and the total deceased remains at 9. The average age of all of our confirmed positive cases is 45 years, with the median age of 42, and the age range is from 0 to 101 years. The average age of all of our active cases is 35, with the median age 31, and the age range of 0 to 69 years. To protect privacy and confidentiality, the average age and age range of those hospitalized cases will not be revealed. The average age of all our deceased cases is 74 years of age, and that age range is between 57 and 91 years of age. The source of all of our cases is as follows. 129 are imported, 196 are local transmission with known or contact source, 21 are local transmission with an unknown contact or source, and 45 are under investigation. It should be noted that as the investigations proceed, transmission categories may change. The 7-day average of our real-time reproduction number is greater than 1, being 1.75, and Bermuda's current country status still remains at cluster of cases. As we can see from the age range of all of our active cases, many of our COVID-19 positive cases are amongst our young people, with the median age being 31 years. It is so important for young adults to realize their role in the COVID-19 pandemic. Even healthy people in their 20s and 30s can catch the coronavirus, as we've seen here in Bermuda, and they can spread it to others and suffer from severe illnesses resulting in lasting health problems or even death. Data from many countries clearly shows that people under 50 make up the significant proportion of patients that are requiring hospitalization for COVID-19. And even if you do not get sick, the choices you make about where you go could be the difference between life and death for someone else. This is not the time to socialize in large groups with people from multiple households. As I said on Tuesday, the ministry's contact tracing team's investigations strongly suggest that it is the social mixing of gatherings of people that are most likely to produce local transmission and positive cases, as is currently happening now. Many cases are asymptomatic, so just because your friends and coworkers do not seem sick doesn't mean that they do not have COVID-19, and they might be unwittingly passing it on to you. I would urge you to stop and think about your loved ones before you engage in any potentially risky health behaviors, especially your elderly grandparents and family members who may be more medically vulnerable, your aunt with diabetes, your father with high blood pressure, your cousin going through chemotherapy. Consider whether your daily actions are putting them and the rest of our community at risk. Bermuda has a disproportionate number of elderly and vulnerable residents due to chronic conditions like high blood pressure and diabetes, and we must consider the potentially dangerous consequences of our own poor choices and reckless behaviors and what that would have and the negative impact it would have on those individuals with those chronic diseases. It is along that vein that I would like to advise the public that, due to the increase in COVID-19 cases we have seen locally, the Chief Medical Officer has issued an order for all care homes to move back to Phase 1 visiting. This phase requires visitors to remain outside unless they are deemed essential, and to have their visit with their resident loved one through a window or a door. We appreciate that this is not going to be good news for the holiday season, but keeping our elders safe is paramount at this time. In addition, we strongly encourage family members, friends, and community groups to be creative and work with the care homes to arrange virtual visits and engagements that align with these restrictions during this period. I would like to now provide a little bit of clarity on what steps a person should take when they are linked to a positive case of COVID-19. If you live with someone who has tested positive for COVID-19, then you must quarantine at home for 14 days and test at the start and after your day 14. If you are a non-household close contact of a positive case and were with that person within 6 feet without a mask for 15 minutes or longer, you too must quarantine at home for 14 days and test at the start and at the end of that 14-day period. If someone you live with is a close contact of a positive case, you must ask yourself whether you can safely separate at your home. And if the answer is no, then you must quarantine at home for 14 days. And if the answer is yes, then you must wear a mask and avoid the 3 C's, closed spaces, crowded spaces, places, and close contact settings. School is positive. What you must do depends on whether or not you are a close contact. If you are a close contact, then you must quarantine at home for 14 days. If you are not a close contact, then you must wear a mask and avoid the 3 C's. I would like to remind members of the public that you need only quarantine if you have been advised to do so by the Ministry of Health's Epidemiology and Surveillance Unit. Not the advice of your neighbor or your coworker or family member, only the advice of the Epidemiology and Surveillance Unit. The situations that I've just mentioned provide common sense guidance to the public in the event that you are living with or interacting closely with someone who has tested positive. These are steps that you can take whilst you wait to hear from the Epidemiology and Surveillance Unit. In addition to the above, we need to emphasize to members of the public the processes when a person is identified as a positive case. In the first instance, the person's GP will notify their respective patients. If that person does not have a GP, then the Department of Health will provide that notification. Once the Epidemiology and Surveillance Unit have been informed of the positive case, we will contact the person to provide them with public health guidance. This notification from the Epidemiology and Surveillance Unit will take place within 24 hours of the Epidemiology and Surveillance Unit being made aware of the positive status. Once a person has been notified that they are positive, you should take steps to immediately isolate from others. And again, epidemiology and surveillance will provide you with the public health guidance. The Ministry of Health team is currently dealing with many queries from people who have been in contact with a close contact of someone who tested positive for COVID-19 or who perhaps work in the same office but not at the same work area as a positive case. These concerns, although understandably justified, are leading to non-science-based decisions on quarantine. I want to stress that it is the Epidemiology and Surveillance Unit who will be in touch with you if we feel that there has been a risk to you of real exposure. I would ask that workplaces please not make decisions in place of the Epidemiology and Surveillance Unit. It is not helping, and it leads to increased demand for testing appointments by people who are not immediately in need of a test. The Ministry of Health is currently providing the highest amount of testing since the beginning of the pandemic. There are available appointments for the community. However, the additional capacity within the testing regime has been adjusted to accommodate the recent outbreak surges that we've been speaking about. This provides specific testing opportunities to those that may greater present a risk to the community. For those people who Epidemiology and Surveillance Unit identifies as needing a test, the ESU team member will make the appointment for you. You do not need to make your own appointment. To all other members of the public, we sincerely apologize for the inconvenience to you for the testing waiting time. However, we hope that you understand the realignment of testing helps us to reduce further spread of COVID-19 and essentially reduce the risk to the general public at large. I want to remind you that if you have any symptoms at all of COVID-19, please isolate yourself and call your doctor who can advise you regarding testing. Likewise, if your physician advises you that you are positive, again, isolate and prepare a list of your close contacts for when Epidemiology and Surveillance Unit contacts you. This Christmas will certainly be different, but if we don't change our behaviors and follow public health guidelines, my fear is that next Christmas there will be families with one less person or more at the dinner table due to COVID-19. In closing, I would like to ask persons who are contacted by our contact tracers to please be forthcoming with information as it pertains to your close contacts. We need this information to be able to trace the potential spread. The confidential information that you provide to the contact tracers may help to save a life. Thank you.
Thank you, Minister of Health, and I again want to say thank you to your team. Most of the matters for the update of which I will give today were given in the House of Assembly earlier today, where I outlined the place where the country is and the additional measures which will be brought into place effective tomorrow morning. Certainly, with the case of the clusters that are here, the fact that over the last 7 days we've reported 113 new cases, with 27 new cases which were reported by the Minister of Health, and recognizing that more than half of those new infections are persons that are under the age of 30. The data shows that residents are driving this current outbreak. And as a result, the actions that the government is taking are again trying to strike a balance so that Bermudians are safe but active, so that businesses are open, but that patrons are not contributing to the outbreak. I will advise, as I had said before, the objective of the government is to prevent us from moving to a place of community transmission. Now, a lot of persons will confuse the terms, local transmission, because we have local transmission. Community transmission is a specific definition by the World Health Organization, and that is where your health teams become overwhelmed, are no longer able to contact all of the cases that they are seeing, and are no longer able to link the cases that they're seeing. We are now able to contact 100% of the persons who have tested positive within 24 hours, which is something that is one of the requirements, and we are continuing to press along that path. But it is critically important that our health teams and our testing teams and those teams have the space of which they can to continue to work. As I had indicated earlier, this additional layering of restrictions on top of the restrictions which were went into force on Tuesday are to, in the words that I use, as an insurance policy, to say that we could wait until December 22nd to see whether or not the measures of which we'd taken and the increased public compliance with mask wearing and others would have an effect, or we could put in further restrictions which would further reduce possible spaces for transmission, which may happen in places where individuals may not be able to observe public health guidelines, and to make sure that we have less transmissibility. That is the decision of which we've taken, and as was indicated, those measures will be reviewed on December 22nd. If it is felt that these measures need to continue, they will be extended, as we must, and I repeat, we must take into account the care which is necessary for the community. As a result, the new restrictions that will come into effect at 6 a.m. tomorrow were, as was announced to the House of Assembly, are as follows. First, all businesses will be required to close at 10 p.m. Second, a curfew will be in effect from 11 p.m. daily, but an adjustment from what was said earlier, the curfew will end at 5 a.m., as per the request of the Minister of Health, who is actually in charge of the regulations. The maximum permitted number of people in any group will be 10. There have been some questions that have come about whether or not that applies to public settings and private settings. Absolutely it does. Some persons said, does that apply to schools and other types of establishments? No, it does not. The guidance states very clearly that schools and other establishments have their set guidance. This is for gatherings in unregulated settings, whether it be private homes, whether it be places of leisure and or recreation. It is critically important that we minimize our movements, minimize our mixing. Right now, when the number of cases are as they are, and we are catching old cases, it is critical that we understand what is taking place inside the island and take the protections and precautions. Gyms will be required to operate at a reduced capacity, that is 20%, and barbers, hairdressers, massage therapists, and spa technicians will not be able to provide any service that requires either the customer or the technician to remove their mask. Key point. So those situations where there's close contact, if there are situations where persons need to remove their mask, those services are not permitted, which means that my beard may grow a bit longer. We know these measures work, as they are specific measures which are targeted towards places where there could be additional chances for spread. It is clear from the results of which we are seeing that the clusters that led to the current outbreak, though their source may have been a single imported case, it is due to the actions of residents that are here in the country. I remember about 3 weeks ago at a press conference giving an example of why it is so important to maintain distance and why it is so important for us to make sure that we are following precautions. I say that because I said that, you can have 30 people inside of a room, and if there's one person that's infected, and if that individual, if the windows are closed, if people aren't practicing social distancing, if people aren't wearing a mask, people are shouting, etc., you can very easily infect 30 people in the space of 2 hours. Unfortunately, that's what we've seen. We have seen what we have warned about happening. And that's why it is critical for us to adjust our behavior. The health teams will continue to contact persons. The testing teams will continue to test persons. The enforcement teams will continue to monitor those persons that are on isolation. But the government cannot do it alone. It certainly, without question, requires all of us to make sure that we are doing our part as well. In addition to the regulations which will be spelled out in law, there's also guidance which will be issued. The guidance issues are certainly, number one, employers should encourage and support employees working from home if they are able to do so. As I had indicated in my statement to the House, heads of departments and permanent secretaries will be relaying matters to members of the public service who are able to work from home. and also persons who are unable to work from home as the precautions that will be taken regarding bubbling and others so that critical government services can continue. For the next 14 days, we're encouraging people not to mix households. Very important. Again, there are cases of virus inside of the country. That much is clear from the numbers of which we've seen. And the incredible testing has been able to identify those cases, and we are continuing to follow up with their contacts. But it is critical that you help and assist to ensure that we can control this current outbreak. Third, I would advise and ask all persons to download the We Health app, which went live today, and which will provide you with instant and anonymous alerts should you be in the vicinity of someone who tested positive who was also running the app. This is important. As was stated, the app does not collect any personally identifiable information. The app is fully privacy compliant. It does not collect your information. It does not even ask for any permission to access any information on your phone. I saw a tweet earlier today where someone had said people who are worried about the We Health app should be worried about other apps like Twitter, etc., which actually request permissions to access things on your phone. This app does not request any permissions whatsoever, and it is key to understand. It is completely private, but it is going to be a critical tool for us to be able to advance out of this phase. Over the next few days, we're expecting, given the number of cases, to continue to rise in line with forecast models that the government is expecting from public health officers. But we can and we must reverse this trend. We'll continue to operate in that transparency, and just as you were able to see the rise in cases, we are confident that the results of our enhanced compliance with public health protocols will see a reduction in cases as well. The next thing that I want to touch on, which is particularly important for persons who have been impacted by the closures which have been mandated by the government. When I was here on Tuesday, I did say that the government would be able to provide relief for those businesses and for those individuals who have been affected by not only the closures of bars and nightclubs, but also persons who have been put into mandatory quarantine and who are unable to work from home. From 5 p.m. today, the website uba.gov.bm, again, that website is uba.gov.bm, and I'm sure we'll have a link added to the government website, went live. And persons who have not been able to work due to closure notices, or persons who have been served with an official quarantine notice and are unable to work remotely, can apply to receive support. The Minister of Finance has stated that any completed application received by 5 p.m. Monday will be processed and paid by next week, Wednesday, December 16th. Verified full-time employees of bars and nightclubs who are closed will be eligible to receive $1,000, representing 2 weeks of the unemployment benefit. And again, that application is live at uba.gov.bm. In order to apply, you will require your full name, your social insurance number, mailing address, contact details, telephone and email, a bank statement that does not need to contain your balances, but it is to ensure payment to the correct bank account, and employer name and contact information. Again, if you need help and assistance, please go to uba.gov.bm. And if you complete an application by Monday, there will be funds in your account for Wednesday. Earlier today, when I spoke to the House, I also stated the fact that our testing teams are under incredible stress. Yesterday, the government lab received over 1,800 testing samples, far and away exceeding any record that was set. Persons who were listening to the objectives of which we set out said that we were looking to test and get up to 1,000 persons a day. So certainly, the issue is not the testing capacity that is inside of the country, because we were able to collect those tests and samples. And the fact that we're able to sample about 3% of residents in the country in one day is an incredible and heroic feat. And so I want to pay homage to the doctors and all of the staff who have been working so hard to make sure that we can meet these specific targets. At the same time, as the Minister of Health has indicated, there are persons who are being, I would say, overly zealous with their desire to be tested. And those are people who have booked multiple appointments for multiple testing days. That is not necessary. Please, please, please reserve the testing spaces for those persons who need and require them, for the persons who may have been exposed on those levels. As the Minister of Health said, if you have not been contacted by the Epidemiology and Surveillance Unit, that doesn't mean that they are behind. It may mean that you are not at risk. And the challenge in which we're finding ourselves is, of course, the panic that is setting in where persons are worried and afraid. Now is not the time to panic. The case numbers are alarming. It is the time to act smart. It is the time to understand the risks. And it is the time to do your part to support our Army on the front line. And our Army on the front line are all of those healthcare workers that are working to test, trace, isolate, contact, and ensure that we can get control of this outbreak. So with that, I'll move on to taking questions, but I want to remind every single person that it is critically important for us to follow the health guidance. Before I close, I also want to remind anyone in our community who are struggling emotionally, feeling overwhelmed or depressed, you do not have to suffer in silence. Please contact the Emotional Wellbeing Hotline at 543-1111. Again, that number is 543-1111. And finally, again, I will give the correct number this evening, that I know some persons have complained that they have not been receiving WhatsApp updates from the government since the hurricane. We are trying to assess what the issue is, but if you would like to receive updates directly from the government on the latest news surrounding the coronavirus, I ask you to send a simple message to the phone number 504-6045. Just go in your WhatsApp and say hi to 504-6045. And with that, I'm happy to take questions from members of the media.
Okay. Don, you want to go first?
Good evening, Don Burgess, Bermuda Broadcasting. Of the people who are positive, but not in a hospital, do you have any breakdown as to how many are ill?
You mean how many are symptomatic?
Yes.
I don't have that information with me, Don. I'm sorry.
All right, thank you. As of yesterday, we had 126 known active cases. That averages around to about 14 per parish. But if you look back in time, these folks were all infected 5 to 14 days earlier. If we take the current R number, because the Premier was talking about the numbers getting worse over the next couple of weeks according to the model, what are we expecting in 7 to 14 days in terms of case numbers?
Well, what we're seeing now, like we've spoken about previously, the incubation period normally is 14 days. So what we're seeing now is the effects of a number of high-profile cases, which we've spoken about, that took place almost 2 weeks ago. Our hope and desire is with respect to some of the new mitigants that are being applied that the Premier has indicated today, including the curfew and the reduction of operating hours of our bars and restaurants, that there will be less socializing and that we will start to see a trend downward with respect to the number of cases that we're seeing, because there's less opportunities for persons to be in those social contacts, which I spoke about, that from an epidemiology perspective, they're noticing that that is where what is driving our current active cases and transmissions.
Thank you. For both you and the Premier, what's your direct message to young people who seem to be driving the new surge in cases?
My direct message to young people that are driving the cases is you saw the median age is like 32, but they're young people, and I think that it's important for them to recognize. I appreciate that, when you're at that age, you probably feel invincible. You feel that this is not going to impact you. If I get sick, oh well, I can shake it off. It's not that bad. I'll continue on. But what they need to do is think about the other members of our community, in particular their family members, because inevitably those persons probably have adults and grandparents that they interact with, or uncles or aunts that have chronic conditions. Unfortunately, Bermuda has a high incidence of chronic conditions. When you look at the death rates that Bermuda's had compared to many of our other countries in the Caribbean, we've had more deaths. Why? PAHU acknowledged, because we have higher instances of chronic diseases. So those young persons probably have grandparents and elderly uncles and aunts and family members, not even so elderly, that have chronic conditions. And my message would be that, think about them, because, yes, you may be invincible and you may feel that, it's not going to happen to me, or if I catch it, okay, I'll shake it off just like a cold. That may be right for you, but for the family members that you're interacting with that could possibly, you could transmit the virus to them, who are more vulnerable. They may not have the benefit because of their own frailties and vulnerabilities because of health to shake it off that rapidly.
Thank you. Mr. Premier, did you want to add anything to that?
No, I don't know those. No, I don't. The Minister of Health has covered it.
All right, thank you very much. Using yesterday's figure, if 126 people currently infected interacted with, say, 100 people on the island over the course of 7 to 14 days prior to testing, that's over 12,000 contacts. How can the 14 contact tracers at the Ministry of Health handle that load, or even a fraction of that load? It seems likely many potentially exposed persons won't get a call.
Well, you're speculating a lot in that question, assuming that all of our all of these persons that test positive interact with over 100 people. Many of the people that they've been doing contact tracing with live lives where they go to work and they go home, and they don't have a lot of contact with other people. Some, on the other hand, have a lot of social contact, so that does take more time with respect to processing and contact tracing. However, as the Premier has indicated, that the contact traces are stretched, which is one of the reasons why we're asking everyone to download that app, because the use of technology is going to help us tremendously. And I think that the Premier's described how the app worked, and you were probably at the press conference this morning when he was speaking about it, but that will assist tremendously in our efforts of contacting people. So we are encouraging everyone to download the app. Again, the contact traces are, according to the World Health Organization, the standard for contacting a person that's a positive case is within 24 hours of being informed that they're positive. And we have met that 100%. That's our objective, and we are meeting it 100% of the time. However, as you've indicated, we are seeing more cases, and we're encouraging the use of technology to assist in that regard, and more importantly, for persons to recognize that this is nothing to play with. And the reality is, it's here, it's prevalent, we are in the midst of a pandemic, and there are things that we can all do individually to help not put a drain on our public health workers and eventually the hospital, which we're desperately trying to avoid.
And I think also that you may be focused on the number of active contact tracers. I think there are more than 50 contact tracers that have been trained, and more resources will be brought to bear. So the fact is that the government will continue to be responsive on those things. But one of the reasons why you implement restrictions on large groups is to make life for contact tracers easier. Now, that life for contact tracers will not be easier this week, but it will certainly be easier next week.
Mr. Premier, you mentioned the review on December 22nd. Hopefully the numbers will be going in a better direction. But if they aren't, could we see a possibly shelter in place, or will there be another intermediate step between that and shelter in place?
I don't think that we want to get back to that place. And I'm going to put it on the people of this country who have been through a lot this year for us not to get back to that place. I think that we understand, I think that most persons in Bermuda understand the risks. And my philosophy is not necessarily trying to govern people on how to live their lives, but to make sure that the way in which they live their lives don't impact others. I think that by and large, though we're not in shelter in place, we are under very heavy restrictions right now. And if we follow and obey those heavy restrictions, we'll see where we are on December 22nd. I think it is perfectly reasonable to assume that there are going to be restrictions that are going to go past December 22nd. And we're going to have to make the decisions based on the science on the ground. The number of cases, of course, which we're seeing are alarming, but we are understand that, some are already in quarantine, different things, all the rest. So some of the assumptions, of course, which may be made are not entirely correct. With that being said, we are going to continue to work through that process. I think that the level of restrictions which we have now is where we are. We'll see where we are on December 22nd if we have to go further. But that decision, of course, is up to the people of the country. And I know Bermudians, having been through this before, I know the vast majority of us will comply, will abide, will ensure, because we want to be in a better place come a few weeks.
Thank you. My last question for tonight. A number of people approached me today and Bermuda Broadcasting with regard to the testing. They appreciate that there were more testing slots available, but it seems like the public took up on it, and a lot of the slots are now taken, and people are saying that they can't get tests until later this month, and in some places, after December 25th. So is it possible that we can increase the testing capacity even more, or are we at our limit?
We have increased the testing capacity even more by adding more hours and slots of availability, as well as in the locations that we spoke about that are not subject to the weather, so they'll be permanent locations. But what I would ask members of public to, let me just give an analogy. When we go to the hospital and we have to go into the ER and they triage you, so they look at your symptoms and they see what's wrong, and then you may be there and there's a sign that says we're going to treat the most severe persons first. So you may be there for 3 hours and somebody else walks in and goes right in front of you, but they're clearly in a more distressed emergency circumstance than you are, right? So we triage them. If you can draw that analogy to the testing, even though we've opened up quite a lot of capacity with respect to testing, because we have seen clusters of cases and we've got outbreaks, we need to triage who gets tested first. And if you are a contact of a positive case, we want to make sure that you're tested, because if you are positive, we need to be able to say you must isolate immediately before you go around and scurry around throughout the community and potentially transmit it to the persons that were waiting in line or don't have a test until the 26th. So this is about triaging it. And if it wasn't for the circumstances that we're currently finding ourselves in with respect to so many outbreaks, many of which could have been avoided, then we would have had not only a rush for people to try to get tested, but we'd have empty spots, right? We can't facilitate the worried well. There are some people out there in the community that make multiple test appointments because they're worried well. And I get that. And it's understandable because this is a very distressing time. But we also have people that need to be triaged, and they have been identified by the contact tracing team as close contacts of positives. And part of the job of the contact tracing team is to identify and isolate. We can't identify if we don't test them.
So
And again, Don, this is important. 1,800 samples received at the government lab alone yesterday. That's not including private labs. If you chalk that up to just under 3% of the population and compare that to any single day of testing in any other country, I'm quite certain that you will find that we are not lacking for testing capacity in this case and instance. But it is critical that we do not try to be our own doctor. What we have are persons who may have shared a minute of space with someone 20 feet away. No, but I'm being serious, running to get tested. And I'm not saying it in a fashion because, as the minister said, I get the fear and I get the angst. I get it. I understand it. But from a question of testing capacity, we have a significant amount. And the teams are working and processing and doing the stuff which is necessary and required. So I don't want it to seem as that way. The minister is going to continue to work on increasing testing capacity. Their teams have done a fantastic job of accommodating the schools and the special circumstances and the workplaces and the symptomatic testing and all the rest. There's so many different things which are going on a daily basis that the team continues to do. So from that perspective, I don't think that it's a fair criticism. I recognize that persons want to get tested. I get that, and I appreciate that people want to get tested. But I don't think that it's fair to state that, someone who may feel as though if they have to get tested is unable to book an appointment tomorrow. The fact is that the people who are contacted by epidemiology and surveillance who require those tests get those tests. And that's why we had so many tests being done yesterday. One more point, and it's something that I made in my statement to the House. We're also spoiled in Bermuda. And we have been because we've had this wonderful testing infrastructure. The test results are going to take a little bit longer. We may not get them in the 12 hours that we used to. Sometimes we get results in 6 hours. They're going to take a bit longer. What's required right now is patience from as many persons as possible.
Can I just add, John, because we've always maintained that the test results should be received between 24 and 48 hours to manage people's expectations. But because of, as the Premier said previously, people were getting them, you get tested and you wake up in the next morning and you've got your test result before you get out of bed. But we need to manage expectations, and the reality is we are testing far more now than we have since the beginning of this pandemic.
Okay. Sorry, just to clarify. So my question was about increasing testing capacity, and your answer is at this time this is how much we're going to be testing.
We have increased testing capacity.
Well, I know. I say
we have increased testing capacity, Don, and that testing capacity is being utilized by those persons that need it most, as opposed to the worried well. I looked at a situation today, and a husband and wife made 6 appointments, nowhere near close contacts. 6 appointments, worried well.
And so what you're asking, Don, is not whether or not to increase testing capacity.
We've done it.
What you are asking is whether or not we will make more appointments available. At this time, the answer is likely no, because you must focus on the people who are required to be tested. There may be testing spaces that are going to open up because the minister's team is canceling all these people, like a family who books 6 appointments and all the rest, which is not necessary and required, like booking one every 3 days. These are the examples which I've spoken about, and these are the things which we're moving away from. But it's key to note that the persons who are required to get tested, who have been contacted by epidemiological surveillance, who are part of clusters, who are close contacts, all the rest, are getting tested.
Thank you. But just to say, it's not about increasing testing, because I recognize that the tests were increased on Tuesday, the amount that were, but it seems like the public absorbed it and took those up, so that up to after December that they're already
How many
booked.
times did I ask the same question? But I accept, Don, I accept what you're saying. But the response is we have increased testing capacity. We are focused on making sure that the people who need and require a test get into those spaces. The Ministry of Health has done an excellent job of optimizing testing capacity, of running special clinics through Perot, which was typically which was reserved for travelers, and doing that and taking advantage of all of the various testing options of which exist in the country. So we certainly have. The issue is, as I said, if you are a close contact, if you have been identified a close contact, you will be notified by ESU, and if you are required to get a test, you will be given a testing slot. So because you can't book the appointment yourself, you should not fret that you're not going to be able to be tested, and that's the impression that I don't want to be left in the public space.
Exactly.
Okay, thank you very much.
And if you are a close contact, you will have an appointment. Thanks, Don.
Good evening, Premier, Minister.
Good evening, Ms.
Good
Palacio.
Maya Palacio from Media Maya. My first question, which is almost like a follow-up from Don's question, is if people aren't to expect, because we're getting so many tests right now, if people are not to expect between 24 to 48 hours of receiving the results, when should they be expecting them?
Between 24 and 48 hours is the norm. However, it may be a little bit delayed simply because of the amount of testing that is being done, and the results and analysis takes time. I'm sure they would rather have the proper result as opposed to something rushed. So normally it is between 24 and 48 hours.
Okay.
It is on the outside, on the rare occasion that 48-hour limit will not be met.
I've had a couple of teachers from, I'm just going to say, Cedar Ridge Academy say they've been tested on Monday and Tuesday and still have not received the results. And they want to know, does that mean that they are negative if they haven't received anything, or should they be waiting for
It means that
something?
they should wait patiently until they get their results. But normally it is between 24 and 48 hours. Again, we appreciate the anxiety. In the meantime, they should follow the public health guidance, which is to make sure that they continue to quarantine and wear their mask and the like. But normally it is within 48 hours.
Absolutely. And on an individual instance, not as if we want to invite people to call the hotline, certainly because it's overdone. But you're not really going. So if someone got tested on Monday and they don't have the results yet, there's a different issue. It may be an issue of someone wrote down their email address wrong, got keyed in wrong, so they didn't get the results. And so it goes, and it's along that level. And so I would say that whoever has asked that question, if you've been waiting for more than 48 hours for a test result, that is unusual because the labs are not that backed up. So I would say that certainly that might be something to follow up with.
Okay, just so you know, it's been maybe roughly about 5 people who said this to me, and so there's multiple teachers, so.
I accept what you're saying, and I'm
Yeah.
not saying that it's incorrect at all. I guess I'm saying that from someone who was tested on Monday, it would be very unusual that they don't have a result from Friday. That just doesn't seem right. So, I mean, if there are specific individual persons, I would certainly encourage them to email the testing information email that they will get, and maybe someone will follow up to find out exactly what the problem is. But that doesn't sound normal.
Yeah, and I
Yes.
just got an email, actually, Maya, from the call center. Technology is so great. And they did indicate it's probably that the email address is incorrect.
Okay, and
Or it's ineligible.
if they did want to email to find out what's the email that they should be using to contact to ask about their results.
I'll get that for you.
Yeah.
Okay, awesome. Locked out. My next question pertains to the
Tell them
We
to
app
email me.
from this morning. I've had a couple of younger generations, so let's say college, high schoolish, ask if they have to be on data to receive the notifications for the app, because a lot of people right now, because of circumstances, took away their plans and stuff like that. So most are prepaid. So would they need to be on data or Wi-Fi to even get the alerts from the We app?
Good question. As long as the phone is charged and as long as the Bluetooth is on, it will be doing the proximity checks to other devices. Once you enter a place where you have internet on Wi-Fi, I think the schedule is, I think it does it once a day or once every 12 hours or something. I can clarify, but the long story short is that it will work. Yes, it will work.
So those people who, let's say, if an alert did go through throughout the day, they'll get it once they get into
Absolutely.
data or Wi-Fi.
Yes, correct.
Okay, so they have to
So
wait.
it's not a push notification. It's not any of that stuff. As I said, it's a very light app on the phone. It doesn't collect personal information. But the answer to your question is yes, it will work. As long as you keep your Bluetooth on, yes, it will work.
Okay, great. Thank you. My next question for you, Minister, pertaining to winter camps for Christmas. People just want to know, have there been any regulations or stipulations put up for that yet?
We're still having discussions about that. As you can appreciate, the major concern is the mixing of bubbles that we've spoken about time and time again. So we are finalizing those discussions, and we will be making announcements in the due course.
Thank you very much. And another one pertaining to the flights coming in, and for residents, will the government possibly be stipulating the whole having government quarantines put up again at residents' pay?
Government quarantine facilities, mandatory government quarantine facilities are not being set up. As I indicated in my statement earlier to the House of Assembly, the Cocoa Reef Hotel has made accommodations of $79 a night, a special rate for individuals who are unable to quarantine safely at home. For instance, someone may be coming back from overseas. They may have an elderly person in their house, the place not, and they want to quarantine somewhere else, and so that is being made available. We are not enforcing mandatory 14-day quarantine inside of a government-run facility. What we are doing is requiring, as I said, the pre-tests before coming and the arrival tests and the new traveler continuum, which restricts movements after the first 4 days or after your third negative test in a space of 11 days. For those persons who do not have a pre-test, those persons will be required to get a quarantine monitoring bracelet and will not be allowed to move from their location, which is being monitored. What is important, Ms. Palacio, and I covered it in the House of Assembly, but I didn't give it in my remarks tonight. Certainly, we've learned lessons from this, and we have increased protections at the border to provide more protections to the country. And so the Minister of Health, as we went over on, I want to say, Tuesday's press conference, has revised the activities allowed for all travelers, and all persons who arrive in Bermuda will be subject to those restrictions, the limits on activities on each subsequent test. But additionally, after the new arrangement, which was announced on Wednesday, with Costco in the U.S., making sure that that testing facility is made available for persons who are in the United States. There is no longer an excuse for residents to not obtain a valid pretest prior to boarding. So the fee for a resident to return without a pretest will be increased from $30 to $300. And this increase will discourage residents from boarding flights without a valid pretest, and it will certainly help to fund the enhanced monitoring of those persons that are arriving without a pretest, which is required and necessary.
Okay, awesome. And for persons who actually get a negative pretest, what should they do? Are they still allowed to come in, or do they still have to pay
Absolutely.
the fine?
Negative pretest is what we like.
I mean, a positive. I apologize. If
If they
have a positive
they
pretest,
will not board a plane.
they will not board a plane. Okay. Oh, but could they still, if they gave the $300?
If they had a positive test, they can't board a plane.
Okay.
The
Just
U.S. ain't gonna let them get on a plane.
awesome. And my next question about the new restrictions that are put in tonight, will there be any stipulations or fines put in place for those who may not adhere to the restrictions?
Under the legislation, I don't have it in front of me, but I think the first offense is $6,000 or up to a year imprisonment, and then I think the subsequent offense is $12,000. I'm afraid I don't have it, but there are penalties, both criminal and financial penalties for breaching of the regulations.
Okay, thank you. And my last question was about the wristbands, the yellow wristbands for persons who do have them going on doing what they are allowed to do within the stipulations. Is there any way, because businesses are wondering, for it to be noticeable, like people have to show it when they come in, or if there can be different colors to represent what day they are on?
At this point, Maya, and thank you for that question. That's an important question, particularly for the business owners. There are, like I said, it's a yellow wristband, which yellow is the international color for quarantine. However, in addition to the businesses having a requirement under the regulations to do contact tracing, so as you walk into a restaurant, you have to fill out your contact details, et cetera, et cetera. In addition to that, then they should also either ask or review, see whether or not the person is wearing a wristband. Now, I know people said, oh, well, it's wintertime, they can close it, et cetera. But part of the wristband is twofold. One is to remind the traveler that you have this 14-day traveler's continuum. So you can only do certain things depending on the day in which your arrival date. So that's the first part. And then secondly, it's a part to allow locals to recognize that person as a traveler, not to play any type of vigilante justice, because Bermudians are hospitable and we expect them to continue to be hospitable. We are a tourist destination. However, it's just to allow you to know that that is a person that has potentially recently traveled. Arrived within the 14 days, and that continuum should be exercised.
Right. It's just most people know that the positive cases always are on day 8 or day 14 now, and since you could have that and be like day 1.
You shouldn't be out on day 1. Remember,
well,
I
if
invite
you got
you.
negative, then you could do public transportation was the thing
I
on
invite
day
you
one.
to look. I'm sorry, I didn't bring it with me. I've spoken about it before. It's the traveler's continuum. It's the 14-day traveler continuum. And it's broken up in, this is what you can do between day arrival and day 1, day 4, day 8, and day 14. I don't have it in front of me, I'm afraid, but
Yeah, me neither. I had it. I was watching. I was
okay.
reading on Twitter,
All right.
and
it's a
so I
great
read.
continuum. So you can see, and it's called the traveler's 14 days. So it shows what they can do. I think, for example, you cannot have an in-person meeting until day 8. So it shows the do's and the don'ts and what you can do.
Correct. And I can't look it up now, but I was sure that it was negative. Then you could do public transportation on day 1, because I remember reading that. But I could be wrong, so I'll go back and check it. And my last thing pertaining to that, though, sorry, going right ahead. I can't remember the question, so I have to call it a night. Thank you.
Okay,
Thank you very
Maya.
much, Ms. Palacio.
John, Jonathan?
Evening, Mr. Premier, evening, Minister, and I'll try and keep this quick. Yeah, my first question was, and you may not be able to give out this information, but I was curious. We've seeing these younger residents. Do we have an average age for these positive cases that we've had during the last week?
I don't have them collectively, but I can tell you the median age of all of the active cases that we have, Jonathan,
It's 31.
is 31.
Yeah. Okay.
And the median case for the ones that you asked for the last week, which I covered inside of my statement, or the statement in the House of Assembly, of which I said for the last 6 days, that's not including the results of which the minister just announced. That was the average age was just under 31, between 30 and 31, and the median age was 28.
Gotcha. Thank you, sir. Mr. Premier, it was a question that came to you in the House. I don't think you were able to answer it at the time. I figured I'd give it a shot. Are we seeing a lot more, because these are younger people, are we seeing a lot more cases that are asymptomatic?
I think someone asked the minister that question earlier as well.
Yeah, I don't have the numbers, Jonathan, of the existing active cases. I don't know what percentages are symptomatic or asymptomatic. I think it's safe to say, because we know recognized internationally that 60% or so are asymptomatic or very mild symptoms. It's probably safe to apply that same international standard here to Bermuda. So those numbers would reflect a large percentage of persons that are purely asymptomatic.
Thank you. And we've heard today that we've got currently 7 clusters. We know that these are typically associated with events where people are mixing. Sort of size-wise, can you give us any details on the size of these? When we hear about a cluster, is there a level at which something qualifies as a cluster?
No.
How big did they get?
No. There's no specific, finite number that says that this is a cluster. I know there's an international definition for it, which I don't have, but it just demonstrates that it's a particular event where there are several positive cases and index cases tied to that particular event.
Okay.
Some clusters are as large as, I don't know, based on the last numbers, but the largest one was up on, I want to say, Sunday up to 25.
Oh, okay. Now, obviously, we know we're working flat out at the moment, but I did hear from people during the week who are having a tough time with the hotline. They just weren't able to get through. They couldn't leave a message. One woman has to travel for a family emergency. She has a parent overseas who is not going to be around much longer. Has that been rectified, or is it just a factor of what's
We did
happening?
have a problem with the lines. Is it IDT? One of the department, I'm sorry, that deals with the government telephone systems is trying to work out they've provided a temporary resolution, but we're looking for a long-term fix with respect to that. But we have had some technical challenges, so I would not only apologize to members of the public for their challenge in terms of getting to the hotline, because again, we have had some technical problems, in addition to it being, overly subscribed, just to continue to just be patient with us and to continue to call back.
Righto, I'll let them know.
Thank you.
And so we've heard the cabinet met last night. I guess, was there anything in particular that was a moment where you decided enough, like let's have a meeting and agree on these restrictions, or what was it that prompted the meeting, if there was anything?
Every Thursday, I get an update from the team at the Ministry of Health, the Minister of Health, the Chief Medical Officer, the government's science advisor, person from the hospital, Dr. Ashton, and the Director of the Health Department, Dr. Spriggs, is in there as well. And we discuss the issues, and I asked for the assessment of the teams, and the assessment of which they gave was what they were seeing, what they were experiencing, what they were encountering. And following that, I called the Minister of Health, and I said, I think that what is from the recommendation which they were giving, and that is the reason why the cabinet was convened with a recommended set of further matters which needed to be done.
Cool, thanks. Any figures for how many folks are on the We Health app now?
Oh, I don't know. I don't get those figures. I will try and find them out, but I would hope that persons have downloaded it, will continue to download it, will install it. I hope that every single person here has it installed on their phone. It is critically important for this particular fight.
Cool. Thank you, sir.
Thank you.
I have TNN on the line. They'd like to ask a few questions. Trevor?
Good evening, Trevor Lindsay, TNN News. Premier, we haven't heard no updates from the bus drivers, the bus BTP. Is there an update on the situation there?
I don't have an update at this time. I know the Minister of Transport was just in the House of Assembly dealing with 2 bills regarding shipping. I will seek to get an update later. I'm uncertain if the Ministry of Health has conducted their assessment.
Next question.
Yes, will there be stipulations at grocery stores on last name basis since the reduction of numbers of gathering to 10 persons? Will you give the implementation of the alphabetical order for grocery stores
No.
moving forward?
Nope. There-
Trevor? Next
My
question.
next question, Premier. The British Airways flight returns tonight with some 232 persons on board. Do you have numbers on locals and overseas guests arriving within over the next 2 weeks? But there's a large number of people arriving tonight. Is there enough test kits to take us for the next, I would say, 3 weeks?
If there's one thing we don't have a shortage of, it's test kits. I think the minister provided answers to the House that we've got about enough capacity to run another 200,000 tests. So we're not, and that's one thing we're not short on, testing. And remember, we're the 5th most tested country in the world, and there are other countries that record antibody tests and other tests as these tests. We only go with the nasal pharyngeal one. So we, no, there's no shortage of testing capacity, no shortage of quarantine bracelets either.
Trevor?
How can the government assure the public that aren't tracking people's information through the WeHealth app? Some may not install the app due to this fear.
Well, the first thing is that I would encourage you not to repeat those fears because they're completely and totally unfounded. The second thing is that if you look at the app, it does not require any permissions for you to install. So you would install other apps and they ask for your permissions. This app does not require permissions. And so you can rest assured. The third thing is it's been signed off by the Privacy Commissioner. And the fourth thing is that this is a very special protocol. I encourage persons to go to the government website, gov.bm, read the information. The protocol of which this is built on is a revolutionary protocol. The way that you can tell and understand that information is not collected is that the Ministry of Health needs you to enter in a special code to alert others because they do not have a link. They don't know if you download the app. It is completely anonymous. So the only thing at which I can say is that I would hope that people would recognize that this app is completely and totally anonymous.
Okay, thank you. Premier, tonight you stated, especially in the House of Assembly, and you stated again tonight, 1,800 tests done yesterday. But in the results announced tonight, there were 1,157 tests results. What is the status on the other 654 cases?
The 1,157 test results were the ones that were received yesterday, Trevor. Some of the tests have to be rerun. There could be a number of reasons why the test numbers received don't necessarily match up with how many tests were actually completed and conducted, excuse me.
And the other key points on that is that, as the minister indicated, those were the results that were received yesterday, not the results of the tests that were conducted yesterday. A very key point. So the results that were received by the Ministry of Health. So when I say that the government lab got 1,800 tests yesterday, that means there's 1,800 tests done on Thursday. But the results that were reported today were as a result of the tests that were reported. So those were likely tests from prior days, either Wednesday or Tuesday.
Okay, Trevor, your final question?
My final question, what is the turnaround response to emails sent to COVID-19 case management at Gov? On Tuesday, this individual has not received a response yet. They're trying to, they're trying to change. I've had a few people that were scheduled for tests at the location, and they want to change to the drive-through because one person has a young, a 1-year-old with them, and they don't want to put them in that atmosphere. They want to change to down to Southside. They're not getting no response or even answers via phone or email. What's their option?
Their option would continue to be patient and to try, because we have, I don't know, you may have missed that part of the press conference. We have had some technical glitches with our phone service. If you're trying to change appointments, the best thing to do is to call the hotline. However, like I said, there's some challenges with it, and I understand that IT, the department that helps with telephone infrastructure, is trying to help us find a solution. But I would just ask those persons, implore them to be patient and to continue calling. I know it's difficult to have patience at this time, but the reality is there's a lot of other people that are trying to get through as well. So we would just ask them to be patient and to continue to call and try. But the number, the COVID hotline, is the number that changes the appointments.
Thank you, Trevor.
All right.
That's it.
Thank you.
Thank you. Question, going back to what I said about the day one, I found it, and yes, it does say on day one you can take public transportation.
Well done.
So thank you. So my question to that is, most people, like we said, get tested on day 8 or day 14, and that's when they get the positives. So it's when most of those cases come back now. On day 8 and day 14, you see the positives coming up. So business
Not day 8 or 14, day 4 and day 8.
Day
Yeah.
4 and
Yes,
day 8.
there has not.
There have been a couple day 14s, but they were already in quarantine because they were immediate contacts of a spouse or household
Yes.
member.
Thank you. And so business just want to know, when people do come in with a yellow band, because they can do public transport on the first day, will the government be able to put in something to show that people are on their first day? Because they can't.
The dine-in, and you're looking at the list, I'm not. I believe dine-in restaurants is day 8. Is that right?
It says you could a picnic outdoors within the.
What does day 8 say about dine-in restaurants?
Day 8 says you can visit a bar and nightclub or immediate activities and go to work. But the day 1 does say you can dine outdoors at restaurants
Correct.
or bars.
Right. So you can dine outdoors. I'm sorry I don't have it in front of me, but the day that you're allowed to dine indoors.
Day 4.
You're sure it's day 4? Because that's if you're staying in a hotel.
Day 4, intermediate travel activities plus dine indoors.
At a hotel.
Doesn't say.
Okay. But when the person goes in, then the restaurant not only is doing their contact tracing, but when you get a test result, it comes to your phone. So they will be asked to show their test result on their phone.
Okay, thank you. And my last question is, will we be stipulating any last names for going inside the grocery stores again? Is that an option because the 10-person thing?
The
Trevor
10-person
just-
limit does not apply to retail establishments, to those things and all the rest. Those are for
Okay.
unsanctioned places where persons may be gathering without wearing masks, in small community settings, in other settings as well. There are no restrictions insofar as the number of persons that can attend retail establishments, etc. Retail establishments know to maintain their numbers. Many of them are doing that already. They don't let a whole crush of people to be in the store at one point in time. As long as people are adequately maintaining their distance and following the health protocols of wearing a mask, that is what's necessary and required. There is no desire to revert back to alphabet shopping days or anything such as that. We are not in shelter in place, and those are the type of things which are necessary in managing on that level.
All right, thank you very much for answering my questions.
No problem. Thank you. Due to the nature of the change in circumstance here, It is likely that we'll be back with you again on Monday, maybe next week, Monday, Wednesday, and Friday. What is particularly important for all persons to note is that there will be one release from the Ministry of Health tomorrow on Saturday with updated numbers. There will not be a release on Sunday, and then we will get back to things on Monday. There will be further information which will be given and will be provided regarding the assistance of which is being offered. On Monday, the BEDC will clarify the assistance which is being offered, which I spoke about on Tuesday, to businesses that have been affected by closure to provide their support as well. I thank everyone for their attention. I'm sure it's been a long week. I appreciate the members of the media for asking the questions, and I hope that Bermuda, you all have a very wonderful weekend, as it is important, and please observe the rules that are in place. I do have complete confidence and faith that together we will be okay. It is a difficult time period, but it is not the time to panic. We know what we must do. If we follow and do what we must do, we will be okay. So with that, thank you, Bermuda, and good